The next presentation is a long time coming, which some of you may know. For those of you who are at our 2019 symposium, you may remember that Dr. Kalivas was going to give this talk then. But unforeseen circumstances being what they are, unfortunately, he was not able to join us. And then last year, we all know what happened. COVID decided to ruin our fun again. And so here we are, third time is a charm. And so it's very fitting to have Dr. Kalivas here today to present his long anticipated presentation entitled Why We Don't Give Up. Thanks, Dr. Kalivas.
Thanks very much, Heather. Boy, I hope I can live up to that intro. So the first thing is I'm going to try to share my slide set. So let me start the presentation on my machine. And let me click share screen. And can you guys see what I am looking at?
No.
Not yet.
Okay, hold on here. Let me try it a different way then. Let me try just, I'm going to give one more, and then Heather, I may rely on you for backup to launch this. Okay, give me a sec. Here we go.
I'm gonna give up.
I'm not giving up yet, right? I'm not giving up. And okay, so give me a second. Oh boy. I see my slides. Do you guys see them?
No.
No. Okay. Well, then let's try.
We believe in
this.
you, though.
Thank you for that. How about now? Yes?
Yes. You have to just select the slideshow.
Okay, here we go. Now, okay, hopefully you see that.
Yes.
Good. So, you know, one of the questions that everyone asks when they're given a diagnosis of cancer, or quite honestly, one of the things that we think about with a lot of things in life is what will the future bring? And I think that's part of what a research institute and a university asks. And I've picked out this model. So some of you may recognize this if you're into science fiction. There was a book called Ringworld, and this was actually a real scientific concept for how humans were going to live off the Earth in this spinning torus thing. That was 1975. And I can tell you that a lot of people thought that this was going to be reality in a few years. And as far as I know, other than putting satellites and a Tesla in space, we're not there yet. But I would like to remind some people that we did see a mini helicopter drone just fly on the surface of Mars recently. So while we might not get there as fast as we hope, it's unbelievable sometimes what the future holds for us, and we just can't anticipate it. So again, other attempts at predicting the future. Here's something that I downloaded from the internet, trying to predict what 1-year-olds, 3-year-olds, 4-year-olds, etc., would look like when they're in their 50s and 60s. And actually, as it turns out, our ability to predict what people will look like isn't too bad, but is incredibly far from perfect. So one of the questions, as we said, what's my cancer going to do? And how well can we predict? So this is a question that gets asked a lot by patients. And I can tell you that I don't know how many times I've sat and had patients tell me, Someone told me I've got 3 months. Someone told me I got 6 months. So there's this very technical thing about predicting things that happen and averages. And formally, I'll read this. The error in extrapolation from medians in populations to predict an individual outcome in that population is inversely correlated with the width of the distribution around that median. Huh? What the heck does that mean? A batter who has a batting average of 200 does not predict what is actually going to happen when that batter comes up to bat next. That's what we're talking about. Here's an example that I give. If I show you all a newborn baby and say, how long will that baby live? What can you tell me? So there's a distribution of the life expectancy of newborns in the US, taken, I believe it was from about 2 years ago. It's actually gone down a little bit because of COVID. But the point is that that baby could live anywhere on this spectrum, and you don't know where that will be. So, an unhelpful answer. That baby will live to be 79 years on average. That is a statistically correct answer, but it is a factually, for that particular baby, a nearly useless answer. A better answer would be, well, most likely that baby will live someplace between 55 to 100 years, because if you guys can see my pointer, this is where most things happen to those newborns 55 to 100 years later. So with that in mind, I'm going to tell you 3 stories about patients of mine. This is really from a bystander perspective. This is a story about these patients, and it just reminds us all about when we think things aren't going well, the likelihood of what's going to happen around the corner is really unpredictable. So I've labeled these patients A, B, and C. This is A, 60 years old, from the East Bay, a lot of lichen planus, which is that stuff in her mouth and cheek I show you here. In 2012, important to keep track of the years here, she had a tumor from the floor of her mouth removed. She had significant surgery. Unfortunately, it came back even before adjuvant treatment was planned. Therefore, she had cisplatin plus radiation, and the tumor actually grew on treatment. Now, if someone had said to her then, what's going to happen? They would have said, well, this is what the textbook says. The textbook says, we can't make your tumor go away on average. We can give you palliative treatments, and they may work for a handful of months before you succumb to your disease. So this is her course. She started with a drug called methotrexate. It didn't work. She started with a combination of very intense chemotherapy with cisplatin, docetaxel, and cetuximab. She had dramatic tumor shrinkage. Then her tumor grew. Another drug, capecitabine, another drug, gemcitabine. Her tumor grew. Her tumor grew. So this is a picture. I'm not expecting all of you all to become radiologists today, but I just want to point out this is lying on her back, looking up as if we're sitting at the edge of the bed. And what I'm circling here is a very large tumor that is involving her jaw. The white is the bone of the jaw, and this tumor has invaded her jaw, as I've circled there. And so now we're up to 2014, and she came to see me. And I said, would you like to be a test pilot? And I said, if you do, there's this trial in Seattle. I want you to go see a colleague of mine, Christina Rodriguez. And so she went to that trial. And that trial was a trial of a drug at the time called MK3475. She came back a couple of weeks later, bleeding terribly from that tumor, was hospitalized, and she said to me, I'm done with this, Dr. Kalivas. I just want to go home and be comfortable. So we referred her to hospice to set up at home. And as I think a lot of us do, we said, you know, I don't know what things are going to happen down the line. Let's see you back in a couple of weeks if you feel up to it. So what we saw was that she came back, she felt great, she had no more bleeding, and it says she restarted the drug. I actually had to twist her arm a little bit. I said, you know, you ought to consider restarting. Climb back into that test plane because I think things are going well. She's like, oh, I'm not sure. And I said, go talk to Dr. Rodriguez. So she actually went back to Seattle, and she did. And while these aren't great pictures, I just want to point out that the tumor bulk from left to right was reduced. So fast forward to 2018. Wait a minute, we were in 2014 before. So my point is, she had a great response, was on the drug for a couple of years, had a very good quality of life, and we thought, wow, this is all behind us. But darn it, her tumor came back, this time further back in her palate. She had surgery in 2018. It came back very soon after the third surgery. We gave her immunotherapy. She was very fatigued, had some side effects from the immunotherapy. We started prednisone to treat some of those side effects. She wasn't feeling very well. Fast forward to 2020, she had come off the steroids. The palate in her, the tumor in her palate had continued to regress. And I quote from my last note, she comes in with a friend today. She is feeling great, no complaints. What did I learn from this? First impressions, I think were wrong. We thought that when this tumor came back, when I first met her, after she had had the chemotherapy and radiation way back in, I believe it was 2013, we weren't expecting this outcome. Second thing, people changed their minds. She had chosen to be on hospice and focused on comfort care. Circumstances changed. She reoriented and repivoted. And when she had her second cancer, we thought, oh no, this is going to be the one that does her in. We were wrong. When she had her terrible side effect from the immunotherapy, we thought that was going to be terrible, and it wasn't. So those are things that I learned from that. So, second patient, Mr. B. This history is an extensive one, starting back in 1966, just a couple of years after I was born. As a teenager, Mr. B had Hodgkin disease, which is kind of a type of lymphoma, for which he received radiation and chemotherapy treatment. Fast forward several decades to 2006. The patient had a tumor now in his saliva gland, the parotid gland. That may or may not have been related to the prior treatments. Some of those radiation treatments can, unfortunately, in a very few cases, cause other cancers down the road. He underwent surgery and radiation again and actually did well. Fast forward another decade, came in with some chest pain, workup for that, had some scans done. We'll be looking at some scans together, and some pulmonary nodules and PET CTs, which showed a lot of nodules in the chest and also some in the groin, and I'll show you those pictures. So I don't think you need to have a medical degree to really look at this. I will just point out that everything that I'm circling in this patient's left lung, all those black spots are abnormal. And way down here in his groin, highlighted by the blue arrow, is also abnormal. So we biopsied those. The thing in the groin was lymphoma, and the stuff in the chest was called non-small cell carcinoma, which they really weren't sure what it looked like. So now, in theory, this patient was now having cancer number 3 and cancer number 4. Never a good situation. So we started systemic treatment in mid-2018, and this is a direct quote from my note, the patient and his wife understand uncertainty of the diagnosis makes prediction impossible. I was trying to treat 2 tumors, one lymphoma, one a cancer of the lung, which we didn't really understand the exact nature of it. And here's what happened. This scan is from mid-2018. You've seen that already. Tumors disappeared. October 2018. December of that same year. March of the next year. Last scan, February 2021. Still remarkably regressed. Mr. B felt great. Continues to feel great. So what did I learn from Mr. B? 4 cancers. Life sometimes just keeps throwing stuff at you. Second thing, Mother Nature doesn't follow the textbooks. One of the things I didn't point out is all these tumors were just in one lung, spread throughout the lung. Why, if these had come from someplace else, didn't they spread in both lungs? How weird is that? Why would someone get one tumor in the chest and a completely different tumor in the groin? Who knows? Uncertainty does not mean futility. This patient, his wife, and I all gathered around and admitted that there was no obvious path forward that was well trod where we understood what would happen. We had to make some assumptions and decide were we going to try something when we really didn't understand what was going on. And so much of what we do in life, in particular in medicine, is make decisions to go forward, even when we're not sure about what the right path is. Third story, March 2018, Mr. C. I met Mr. C after he had come to see the surgeon and then transferred to the ER because he had a very large tumor on his face, bleeding profusely. In the emergency room and in the emergency department and in the hospital, there was a lot of concern that Mr. C was going to die and not die in the future, die during that hospitalization. There was talk about do not resuscitate. He understood that he was going to have bleeding and this was very unlikely to stop. Interestingly, it did stop and he was sent home to come back if and when he felt able to do so. To give you a sense of the size of this, again, I don't expect you to understand the technical details, but this is a scan of his mid-head. What I'm circling is an absolutely enormous tumor that was growing in front of his ears and around his whole cheek and down to the level of his mouth. So I met the patient in clinic soon thereafter. We had a goals of care discussion. I said, what do you want to do? What are your expectations? He said, my expectation is this tumor is going to kill me. And I said, what do you want to do? Do you want to try something? He said, well, can you do something about this? I said, I don't know. So we said, let's follow up with that informational visit with hospice. This is again a direct quote from my note. He understood the very limited possibility of benefit and likely mortality. He didn't want heroic measures. We discussed bleeding to death and how to manage that and how to deal with it. And this last bullet, oh, by the way, he was enrolled on a clinical trial. So, as we saw him after that, in my first follow-up, he felt better. He was walking around. He was spending none of his waking hours in day. He had had a dramatic response even to a single dose of treatment without significant AEs, adverse events. That's our fancy way of saying side effects. He still had this very large tumor on his face, but it was much flatter than it had been. So fast forward to November, the large tumor I showed you originally was now almost completely gone after continuing on that treatment. So that was 2018. Now fast forward to very recently. His spirits are good. He doesn't have any symptoms. His ability to eat, swallow, and exercise is unchanged. He still continues to be vigorous. His biggest concern is about coming into clinic and COVID exposures. So we've done telemedicine visits most recently. What did I learn from him? Again, we do not see the future very well. We're bad at prediction. People change in their outlook. He had very much had been thinking, I feel terrible. I want to focus on my comfort. No road to the future should be discounted out of hand. This is Mr. C. His wife sent me this video actually a while ago to give you an idea about how active he is and up and around. Here we go, jogging, running to the future. And away he goes. Those are my stories. That's why we shouldn't give up, because we don't know what's happening tomorrow, the next day, or around the corner. And here are some great examples of people that I've had really the honor of watching them as they go through these endeavors. Thanks. That's all I have.